let's get started. So I hope that you guys have studied at least the basics of epidemiology. So we are going to start with the first concept, which is the number needed to treat. Okay, the number. What is number needed to treat? Now, number needed to treat is defined as the average number of people who need to be treated to prevent one additional bad outcome. I know this sounds to be very technical and tricky, but in actuality, it's very simple. It's, in other words, I can say NNT to be the number of patients needed to be treated for one of them to benefit. For example, you are giving a drug X to 7 patients. All right, you can see here, you are giving a drug X to 7 patients to prevent a carcinoma or any disease XYZ. Okay, so what would be the number needed to treat in these patients? Okay, so the patients that you're seeing, seeing 1, 2, 3, 4, 5, 6, 7, and one of them is dancing because out of the 7 patients that you had given drug X, one of them got treated. So what would be the number needed to treat? So what can they ask? They can also ask you the number needed to treat in terms of absolute risk reduction. Okay, they would be giving you absolute risk of control group and the absolute risk of treatment group. And you have to calculate the absolute risk reduction, which is just the inverse of number needed to treat. So here in the definition, you can see that number needed to treat is defined as 1 upon ARR. Now, what is absolute risk? Absolute risk is the number of events in treated or control groups divided by the number of population in that group. All right. So ARC is basically absolute risk of events in control group. ART is absolute risk of events in a treatment group. So absolute risk reduction is ARC minus ART. So you just have to by heart these formulas and you will be able to solve the questions. Okay, quickie quiz time. This is my favorite section. Okay, I'll be giving you exactly 2 minutes to answer this question. And okay, a randomized control trial is conducted to assess a new treatment for COVID. In the control group of 100 patients, we have 50 patients who developed severe complications, whereas in the treatment group of 100 patients, 10 developed severe complications. What is the number needed to treat for this new drug? Let us solve this question. We were given an information about the control group. All right. We were given the information about the control group, which was total population equal to 100. I've given that out of 100, we have 50 patients who developed an event. So we are not concerned whether it's a good event or a bad event. It's just an event. Okay. So ARC over here comes out to be 50 by 100. All right. Now, in the treatment group, 100 patients, out of which 10 developed a severe complication. So second will be treatment group. In the treatment group, again, we have 100 patients. Out of these 100, 10 developed an event. Okay. So our ART comes out to be 10 by 100. I hope this is simple. Now, we have to calculate absolute risk reduction. It is ARC minus ART. Now, you would notice that I haven't divided the fractions. I've just kept the fractions. So it becomes very easy to calculate for me. All right. So what is the answer? I have 40 by 100. So what is 40? Now, this is my absolute risk reduction. Still, I'm not cancelling out the fractions. I'm not converting the fraction into decimals. I'm keeping it in fractions. So number needed to treat is equivalent to 1 upon ARR. So this comes out to be 100 divided by 40. So what is 100 divided by 40? 2.5. This is your answer. I hope it's simple now. Okay, one more question. Clinical trial is comparing drug A to patients on placebo to prevent myocardial infarction in patients above 60 years of age in a period of 10 years. 20 patients needed to be treated with drug A to prevent one myocardial infarction over a period of 10 years. So from this very line, 20 patients needed to treat. So we know that it is giving us the answer. It is number needed to treat, which is 20. And since these 20 patients were given drug A to prevent one myocardial infarction over a period of 10 years. So out of these 20 patients who have been given a drug A, one of the case of myocardial infarction is being prevented in a period of 10 years. So I don't need to read anything further. What is the number needed to treat for drug A in a period of 10 years? So they're just giving away the answer. They have written 20 patients needed to be treated from drug A to prevent one myocardial infarction. So the answer is 20. So a lot of questions come on relative risk as well as attributable risk in plab. So you need to be thorough with the differentiation between both the terms. All right. So let us see what relative risk is. Relative risk is defined as the relative difference between the events in the exposed and non-exposed groups. So basically, relative risk is the relative difference of developing a risk factor between the control and treatment groups. In other words, So relative risk is defined as ART upon ARC. So this is the formula that you need to by heart, which is ART divided by ARC. Now, comparing attributable risk and relative risk. Okay, attributable risk is the risk of developing a disease in one group. So you must be seeing that attributable risk is either ART or ARC. We have two types: attributable risk in control group and attributable risk in treatment group. So it is basically an isolated risk. It is basically determining the risk factor of developing a disease in a particular isolated group, either treatment group or the control group. But relative risk is a comparison. Okay, it is comparison of relative difference between the events in two groups, which is the control group and the treatment group. So in relative risk, you are comparing the probability of developing a risk in the control group versus the treatment group. All right. So relative risk is, if you get a statement that relative risk is less than one, then the relative risk of developing disease is likely to be less in treatment group compared to the control group. Why is that? Because in this formula, you can see relative risk is equivalent to attributable risk in treatment group upon attributable risk in control group. So, uh, sorry. So the if it is less than one, then the ratio is going towards the attributable risk of control group. That means in any study, the control group has more likely tendency to have that risk factor. But if the relatable risk is going more than one, so according to this fraction, it means that the tendency of developing a risk factor is more in the treatment group. I know it might sound a bit confusing, but for solving the questions, you just have to remember this formula, which is RR is equal to ART divided by ARC. And if you are able to calculate how if you are able to determine how ART and ARC are calculated, then you can very easily determine how RR is calculated. So we'll see a question on this again. Consists of 100 people. 3 people became blind in group B, which consists of 100 people. All the participants in group B were given a trial of a new drug called Hanitol, whereas group A did not receive any treatment. Given the above data, what is the correct statement? Okay, so they are asking us what is the correct statement. They haven't asked us to calculate relative risk or the attributable risk. So we have to calculate both of them, and we can do it. Absolute risk is what? Risk, not absolute risk reduction. So as I had told you, that absolute risk is never a differential quantity. It is always an isolated quantity. If they're asking you absolute risk, it cannot be an absolute risk like 1.3 or anything. If they would have asked absolute risk of group B or absolute risk of group A, then we had to calculate the absolute risk. But in this case, they haven't done that. So if they would have asked us absolute risk reduction, we have to calculate the absolute risk of group B and then subtract it by the absolute risk of group A. But in this case, the answer can't be absolute risk. So ruling that out, I know it is either B, C, or E. So it made my job easier. I just have to calculate relative risk. I have to calculate relative risk, and I know the formula of relative risk, which is ART divided by ARC. Very simple formula. ART is technically ARB, which is treatment. So it is 3 by 100. And the other group, which is ARC, which is technically ARA in total. So we know that it's 4 upon 100. Relative risk is equal to ART divided by ARC, or AR absolute risk of group B divided by absolute risk of group A, which comes out to be 3 divided by 100 upon 4 divided by 100. Cancel out the hundreds really easily right here, and 3 by 4. I know 3 by 4 is 0.75. So if, again, in this situation, if I would have kept it like 0.03, 0.03 or 0.04, a lot of people who are not good with calculations won't be able to divide 0.03 by 0.04. It becomes very difficult for certain people, not because they are not able to calculate this. So the best method is keep things in fraction. Don't cancel anything. Keep it in fraction and make your calculations easier. So the answer is 0.75. Okay, clinical studies and trials. Now, I know a lot of you must be confused in this section. Okay, it becomes very difficult to understand clinical studies and trials. So whenever you come across the differentiation between experimental and observational studies, you have to ask this question to yourself. Okay, there is a researcher and he has been assigned a research project. Okay, so in first scenario, the researcher has to do an experimental study, and in the second scenario, the researcher has to do an observational study. So in case of an experimental study, if the researcher is doing an experimental study, you have to ask the researcher that is he giving an intervention to his study participants. Intervention can be in any form. For example, is he doing a surgical intervention, for example, pancreaticoduodenectomy, or is he doing a bronchoscopy in the patient, or is he doing a ophthalmoscopy in a patient, or is he prescribing, or is he doing a clinical trial by giving them a certain new drug or any existing drug? You have to ask the question to that researcher. And if he says, yes, I am giving an intervention, then you come across an experimental study. Now, if you understood that it's an experimental study, the next question will be, were the study participants randomized to receive the exposure? Now, what is this term called randomized? So randomized means that are the study population or the study subjects in the study selected based on a random outcome, or are they selected based on certain characteristic features that they share? For example, if you're conducting a study to study the efficacy of an oral contraceptive in reproductive age group women, all right, you are a researcher and you have created a new oral contraceptive pill, and you want to study the efficacy of this new oral contraceptive pill in the reproductive age group females. So you are selecting all the females who are in the reproductive age group. So that is a non-randomized control trial, because you are selecting the study population who are who share a similar characteristic, which is being in the reproductive age group. All right. um, for plab level, you don't need to differentiate between the randomized or non-randomized control trial. You just need to know that if an intervention is being offered by the researcher, then it is a experimental study. What is an observational study? Now, first we saw the researcher one who was, a very enthusiastic researcher. He's developing new interventions. He's very enthusiastic. He wants to, experiment more. But in this situation, in situation two, you come across a researcher who is, very calm and composed type of a researcher. He's very patient, and he's ready to observe volunteers in a research. So he's that kind of an old researcher that you would find in every laboratory, and he has some hypothesis in his mind which he wants to prove right, and he's just there sitting patiently, calmly, and observing the study participants. So if you come across this kind of a researcher and you ask him, okay, sir, will you offer an intervention to your patients? He would say, no, I won't. I will just observe them. So he is conducting an observational study, a case control or cohort study. Now, for PLAB exam, you are only concerned about case control and cohort study. Okay, so just remember, if it's an observational study, if the researcher is just observing the patients and not prescribing them any intervention, then it is either case control or a cohort study. That's it. You are not concerned with a cross-sectional study, because I have not seen questions asked on cross-sectional study. It is very rare that they would ask you a question on that. Okay. Now we come across a case control study. So what is a case control study? As we have discussed, that case control study is an observational study. That is, the researchers do not give any intervention in this study. Okay, mark my words, they do not give any intervention. All right. So case control studies are always retrospective studies. Say it out loud. Case control studies are retrospective studies. Prospective case control studies do not exist. Just say to yourself, they do not exist. So if you see a option of prospective case control study, just rule it out. The first thing that you do is rule that out. You can't mark that option. Okay. So an outcome has already been identified, and the researchers go behind to look for the connection between exposure and outcome. Okay. Now, what is an outcome? Outcome is basically a disease. For example, um, the researchers will initially identify two groups, a case and a control. So, what are case? Cases are basically the group of people who developed a disease. And what are controls? Controls are the group of people who haven't developed the disease. All right. So, in the example, we can see a group one consists of lung cancer patients. So, group one is your case, and group 2 consists of non-lung cancer patients. So group 2 is your control. And the researchers will take a history of group 1 and group 2 patients to see how many of them were smokers. So the researchers here are trying to link the connection between smoking and lung cancer. So the topic of the study can be to study the effects of smoking on lung cancer. The next step that researcher will do is he will take a history of both the people in these group 1 and group 2, study the effect of that has led to an outcome. So the effect that we have to identify here is smoking. So he will take a history, retrospectively go back and see how many people in group 1 who developed a lung cancer were smokers, and how many people in group 2 who did not develop a lung cancer were smokers, so that he can interlink the connection between smoking and lung cancer. I hope this is clear. Okay, now what is a cohort study? Again, cohort study is an observational study as well. That is, the researchers do not give any intervention in cohort study as well. Now, cohort study can be prospective or retrospective as well. Okay, but retrospective cohort studies are rarely asked. So I can very confidently say that if you see a retrospective cohort study, it is 80% chance that it is not the answer. So you can rule it out. Retrospective cohort study and um, prospective case control study. Rule out these two answers. This is a pro tip, guys. You can note it down. To rule out retrospective cohort and prospective case control, they can never be your answers. Now, the researcher identifies the exposure first and then follows the patient in the future to look for the outcomes that the patient may develop. All right. Now, this is a very interesting type of study, and this is mostly done by the type of researcher that I was talking to you about while discussing observational study. Okay, these are like 60 plus, old professors who are very peaceful in their life. They have nothing to do, and they will just sit back, relax, have an hypothesis set up in their mind, and just observe the patients to see what kind of outcome they would develop in future. So, seeing a simple example, Group A consists of patients who smoke, and Group B consists of patients who do not smoke. All right, and both the groups are followed in the future to observe which group of patients would develop a lung cancer. All right. I hope this is clear, and I hope the difference between case control and cohort is also clear. The earlier example was a case control study, a retrospective case control study. That is, the researchers were taking a history of smoking in lung cancer patients and non-lung cancer patients, right? But in a cohort study, the exposure has already been defined, which is smokers and non-smokers, and they're waiting for the people who are in group A and group B to develop a lung cancer. All right. So just remember, cohort studies are really expensive studies and really long-term studies. Okay, you need a lot of resources, you need a lot of committed researchers as well as committed patients, so that you can follow them up in future. Because most of the times in cohort studies, the patient might die or the patient might lose interest, and they won't be a part of your study. So it requires a lot of efforts to commit to a cohort study. But in a case control study, you just you have defined outcomes, and you just have to go and search for the exposure in their history. So most of the times people do case control studies as it is easier. Okay, randomized controlled trials are RCT. Now, this image gives you everything that you need to know about RCTs, and I had explained it earlier as well. Randomized controlled trials most likely are randomly allocated. That is, the people in the group, they do not share any common characteristics. So the people in this group can either receive a treatment or they might receive a placebo. So the people who receive a placebo can also be called as control group. All right. But do not confuse it with case control group, because in the case control group, it's just an observation. Even the cases are not receiving any treatment in case control group. But in an RCT, there might be controls, but the cases are receiving a treatment. And even controls are receiving certain thing, something, which is basically a placebo. And placebo can be anything like a peppermint chewing gum, or any toffee or candy that they are receiving, and then they are followed, and the outcome is compared between the group which is receiving the treatment and the group which is receiving the placebo. So the major thing that you need to remember in order to differentiate between a case and a case control cohort as well as a randomized control trial is that randomized control trial is an experimental study. There, the researcher is giving them an intervention. The researcher is giving the groups an intervention. Whereas in case of case control or a cohort study, it's just an observational study. The researcher is just observing the groups, and he's not interfering with their lives. All right. I hope this is clear. Let's move forward. Okay. In a recent observational study conducted at a local hospital, two distinct groups of patients with chronic migraine are examined. One group is administered drug A, while another group is provided with drug B. The outcomes related to the frequency and severity of migraines are then measured and compared between the two groups over a period of 5 years. Which type of study design does the above scenario best represent? So, first of all, you guys have read this first line. It is clearly stating that it is an observational study. All right. The study is an observational study. So it is a very clear giveaway that it cannot be an RCT. All right. It cannot be a RCT because again, the recent observational study conducted. So since it's an observational study, they are not giving any intervention. But you would again, argue with this point that you can read in the third line that one group is administered drug A while the another group is administered drug B. So how can't it be an experimental study? But in the question, they have never mentioned that the researchers who are conducting the study have administered the drugs to the groups, right? So this can be a possibility that the groups have been taking this drug previously, like before the study, prior to the study has even been conducted, these drugs might be, given to the groups by any other doctor, any XYZ doctor, and not the researchers who are conducting the study. So it can't be an RCT because it is not mentioned in the question that the researchers are giving the intervention to the patient. And one more thing, that it is mentioned clearly that this is an observational study. So it can either be A, B, D, or E. So as I had told you, that it can also be a case control. It can also be a cross-sectional study. It can be a prospective cohort. But when I told you that retrospective cohort is very rarely asked, so you have to, you have to rule it out. It can't be a retrospective cohort study. Now, to differentiate between a prospective cohort and a case control, it is a bit difficult to, differentiate between the two. But in this study, they are studying the outcomes related to migraine. So they are following the patient. They are following the patient in the future. All right. So it is mentioned here that the outcomes related to the frequency and severity of migraines are then measured and compared between the two groups over a period of 5 years. Okay. In a period of 5 years, they are comparing. So they're going into the future. And I told you that a prospective case control study does not exist. If they would have mentioned that they're going retrospectively, that is, they are taking the history of patients to find out the exposure, then I would have gone for a case control study. But here in this question, it is very clearly mentioned that over a period of 5 years, they are comparing the outcomes. So the answer has to be a prospective cohort. I hope you guys liked this question. It was a very tricky one, and it was a question in our November 23 plab exam. Okay, one more question. Okay. 350 patients who had a pancreaticoduodenectomy for pancreatic cancer were recruited in an experimental study. Again, it's a giveaway experimental study. This tells us that the researchers are the ones to give the intervention to the patients, right? So the first group received a drug A, while the second group received a drug B, and they were followed for 3 weeks for the next 4 years. Oh, what? They were followed every 3 weeks for the next 4 years, okay, to determine cancer reoccurrence. What is the most likely type of clinical study in this scenario? Okay, so it is a clear giveaway that they are telling it is a experimental study. If it would have been an observational study in the in the question, then the answer would have changed. But this is an experimental study, so this gives away the obvious that the intervention that is received by the first and the second group is given by the researchers. So it has to be C RCT, which is a randomized controlled trial. Okay, so here we come to the end of our lecture. I hope you guys really enjoyed this lecture. And there are certain topics like sensitivity, specificity, and positive predictive value, negative predictive value, and incidence prevalence. I could have included that, but it would have been a very long lecture. So we'll do it some other time. Till the time, I'll be giving you certain tips and tricks to manage your time. Okay. So the first and most important thing is focus on the numbers, not on the words. Okay. So the questions that come in the exam are very identical to the questions that you will see on the plabable category questions or the plabable mocks. Okay, the length is very similar to that. There might be certain questions that are 1 page long. You will see questions that are covering just one entire page, and they might be simple questions like asking you about any intervention, like is it a X-linked recessive disease or anything. But they will be giving you one complete page of history, which consists of all the nonsense things that you have to rule out. In these kinds of questions, you just have to look for the keywords. All right. But in case of epidemiology and calculation based questions, you have to focus on the numbers. For example, I'll show you this question, which even I had given you. Okay, so here you can see there are a lot of words that are there. So you don't have to focus on these things. You just have to see like 4 people in group A out of 100. So you know it is like 4/100. And in group B, you can see it is 3 people out of 100. So you do your fractions 3/100. And you next thing that you have to see is the group A or the group B, the treatment group or the control group. Okay, so predefine your knowledge and all your time, save your time in writing things down firsthand. Okay. So focus on the words and not the focus on the numbers and not the words. Just neglect the extra history that they're giving you. Okay. And the second most important thing is to always make a table. Even if you're solving a genetics question, like you have to answer whether it is X-linked recessive, autosomal dominant, autosomal recessive, X-linked recessive, X-linked dominant. You should always make a Punnett square. Okay. They would ask you what is the probability of the son or the daughter transmitting transmitting the disease if the parents are carriers in case of an autosomal recessive condition. So even if you know the fractions, you should always make a table, because it hardly takes you like 15 seconds to make a table. But if you make a table, you will never get confused and you will never go wrong in this question. Because trust me, guys, there were around 5 to 10 questions of genetics, and they were asking us like all those easy questions. But still, while when you are in the exam, you have that pressure of time, and you will always get confused that okay, if is my calculation right or wrong. Similarly, in case of epidemiology, you will have questions in incidence, prevalence, or sensitivity, specificity, where they're asking you true positive, true negative, false negative, or the probability of all those things. So always make a table, guys. It is very helpful. It might take you like 15 to 20 seconds, but it is worth it. You will never go wrong. The third most important tip is use fractions in place of decimals. All right, always in your calculations you should keep things in fractions. Do not cancel out the fractions. Okay, don't try to make them in decimals. Otherwise, you will commit mistakes. Even though if you're good in calculations, you think like, okay, I had taken mathematics in my 12th grade, so my maths is great. Even I have taken mathematics in 12th grade, but I know how many silly mistakes I used to do in mathematics. So that's why I never break down fractions. That is my biggest fear. Even if it is a simple fraction like in hundreds, always most of the times they give you the denominator being 100, so that has to be cancelled out, or the denominator is the same number, so that gets cancelled out. But it's always better to cancel out in fractions rather than decimals. Fourth important thing is always find the keywords or the clinchers in your questions. All right, this is very important, especially in the conditions where you get a whole one-page question and it is filled up with different kinds of history. Like the patient comes to the emergency department and he was having headache, vomiting, and 10 years ago he was a smoker. He had lung cancer history. So many distractions are there in the question. So you should always focus on keywords and those clinchers. And fifth and most important tip is that do not take more than 2 minutes to for the calculation questions in epidemiology. All right, 2 minutes is it's enough, more than enough to do those calculation questions. If you're taking more than 2 minutes, just skip the question. Okay, just skip the question. Go to the next question. Never take more than 2 minutes in a calculation based question, and never take more than 1 minute in a normal question or a one worded question. Always remember the one worded questions you shouldn't be confused in those. Those are the fastest ones. You can do it in 1 to 2 seconds. All right. Save your time in these one-worded questions and utilize the extra time in calculation-based questions. Okay, so you can follow us on Instagram. I have created a new channel where I'll be uploading interesting cases, like reels of interesting cases, short notes on high yield topics, latest GMC guidelines and updates will be uploaded there. And those who need further guidance on their plab pathway, I can help you guys over there. And these kinds of free lectures will be conducted every weekend. So I'll be taking a new topic every weekend. And I will be uploading it on our YouTube channel, which is also named Medflash, and you can subscribe to our YouTube channel as well for free content. And that is it, guys.